Hello, this is Sudharshan, and in this episode PA 28.14, we will talk about renal cancers or renal tumors. So there are two important ones. One is renal cell carcinoma, another is called as nephroblastoma or Wilms tumor. So first, coming to renal cell carcinoma, as the name suggests, it is a tumor that affects the kidney cells, the proximal epithelium, that is what. And the leading cause of renal cell cancer is von Hippel-Lindau disease, that is where a short arm of chromosome 3 is affected. And apart from that, we can have some other factors like asbestos exposure, drugs, very commonly NSAIDs, smoking, that is addictions like smoking, alcohol, illicit drugs. So these are the different causes. And with respect to the types, there are three important types: clear cell, papillary, and chromophobe. Clear cell is the most common, where we see surrounding, that is nothing but the cell is empty. The fluid material is empty. There's nothing. Only just the nutrients, that is the glucose and fats, that's all will be there in the fluid material. Then papillary, that is where we see the outward folded epithelium, that's what will be there. Here genetic mutations like MET gene, MET is there in chromosome 7, and it depends if the staining, so if the staining characteristics are significant, then the tumor is of good prognosis. And then chromophobe, as the name suggests, chromo is color, phobe is hating, so color hating. So we can see like very pale cells, there is no color, and surrounding the nucleus, nothing is there. That is why it's called perinuclear halo. And then when it comes to the risk factors, okay, as I've already explained, the risk factors in the starting. Okay, now let us see clinical features. Mainly we will see hematuria, that is blood in the urine. Then the pain will be there, flank pain, suprapubic, sometimes perineal, abdominal, but very commonly flank pain is observed. Then apart from that, we can also see the body weakness, that is fatigue, tiredness, weight loss, cachexia, and most importantly, paraneoplastic syndromes. That is nothing but where the tumor secretes excessive amount of hormones. Like it can be localized or even different sites, maybe it may be there and start secreting those hormones. But anyway, our focus is on kidney with respect to paraneoplastic syndromes. It is basically the different hormones it will release. Like if it releases EPO, erythropoietin, it will increase the RBC count, polycythemia. And also we have this release of prostaglandins and PTH. So excess calcium will be there. Yes, and if the kidney releases renin from the juxtaglomerular cells, RAS system will be activated. So hypertension, increase in blood pressure will be there. And also sometimes glucocorticoids, that is secreted by the zona glomerulosa of the renal cortex, that causes Cushing syndrome. Right. And with respect to the diagnosis, imaging can be done to check for tumor metastasis, like CT, MRI, ultrasound. And with respect to treatment, it will be surgery with chemotherapy and radiation therapy. Targeted molecular therapies we can use. And with respect to prognosis, it is very challenging to treat renal cell cancer. And the next one is nephroblastoma or Wilms tumor. As the name suggests, this is a tumor that forms and develops in the kidney. Right, and this is very common in children. Those are of roughly 3 to 5 years of age. And the most important cause of nephroblastoma is WAGR, Wager syndrome. W as in Wilms tumor, A for aniridia, there is no iris. G for genitourinary abnormalities. So urinary tract and the gonads are affected. That is what genital system is all about. And R is retardation, that is mental retardation. And the chromosome that is affected. So basically two genes are there, WT1 and WT2, the Wilms tumor genes, out of which WT1 is more important, where chromosome 11 is affected, chromosome 11. And there is also, WT2 as well, right? But it is very unclear how these genes are really responsible. And the tumor can spread to different sites, okay? It can mainly spread to the gonads, as I said, genitourinary abnormalities, that will be a complication. And then clinical features. So there will be fever, flank pain, hematuria, dysuria, then the Weger syndrome, which I have explained. Then it can all progress to kidney failure as well. And with respect to the diagnosis, we can go for imaging for the detection of the tumor. And with respect to the treatment, it is surgery and chemotherapy and radiation therapy, and the prognosis very challenging. And gross and microscopy, let us see, that is morphology. How does it look? So grossly we can see it's a spheroidal tumor. That means it looks spherical, like a spear. And it looks, and the cut section is fish flesh. And the pelvic calyceal system, that is between the renal pelvis and the calyx, that is compressed. And also some amount of the renal tissue might be affected. And microscopically we can see poorly formed glomerulus which is not developed. We can see tumor cells that are anaplastic, undifferentiated, and abortive tubule. That means the tubule also is not developed. So that is all with the renal tumors. So thank you so much. We'll see in the next lesson.